So if a patient is choking, this is deemed as a medical emergency and we need to get help quickly. We then need to assess the patient to see if they can cough effectively and clear their own airway. If they do have an effective cough, we're going to maintain hands off. But if the cough is ineffective, then we need to intervene with choking manoeuvres to try and clear the patient's airway. We are now going to demonstrate how to manage a patient with an ineffective cough by doing some basic manoeuvres. So Kerry is wearing a training vest for the purpose of this so we can safely demonstrate that. And I've come to find a patient who is choking with an ineffective cough. So Kerry, I'm going to deliver some back blows. So lean forward. I'm going to do 5 sharp blows in the centre of the back, between the shoulder blades. 3, 4, 5. And that's been ineffective. So we are now going to do the abdominal thrust. So finding the belly button and the zippy sternum and placing my fist in the centre. Other hand over the top. 1, 2, 3. And that one has come out. If that was unsuccessful, I would do 5 attempts at that and then we would continue with the back blows.
In this video, we will teach you what to do if you found someone collapsed. The initial assessment is called a primary survey. This is a quick, early assessment to establish how best to treat a casualty in order of priority. We can use the initials Dr. ABC or DRABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response? You can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the ABPU scale, and each letter can represent the casualty's level of response. A, alert. V, response to voice. P, response to pain. And U is the casualty unresponsive to stimuli. If there's still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there's no problem with the airway, it is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with 2 fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, to do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible, dealing with any life-threatening conditions as you find them. Call for emergency help. Call 999 or 112. And that's how we perform a primary survey. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate. A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 milligrams, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become unresponsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 milligrams of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Burns and scalds are damage to the skin caused by heat. A burn is usually caused by dry heat and a scald is caused by wet heat. You need to stop the burning by cooling the burn as soon as possible. This will decrease the severity of the injury. If someone has a severe burn, they may develop shock, which is a life-threatening condition, and they will need to get to the hospital as soon as possible. There are 5 signs which may be seen when someone has a burn or scald: red skin, swelling, blisters on the skin, peeling skin, or the skin may be white or scorched. If someone has a burn or scald, move them away from the source of the heat to stop the burn getting any worse. Then start cooling the burn as quickly as possible. Place it under cool running water for at least 10 minutes or until the pain feels better. Don't use ice, gels or creams, as this could damage the tissue and increase the risk of infection. If the burn looks like a serious burn or it's to a child, it's larger than the size of the casualty's hand, it's a burn to their face, hands or feet, or if it's a deep burn, then call 999 or 112 for emergency help. If possible, get someone to do this for you while you continue to cool the burn, or use a speakerphone if you're on your own. Gently remove any jewellery or clothing near the burn, unless it's stuck to it. When the burn has cooled, cover it lengthways with cling film, get rid of the first 2 turns of film and then apply it lengthways over the burn. Use a plastic bag if you have no kitchen film. This will protect the burn from infection. Never burst any blisters which may have formed, as this may increase the risk of infection. Do not use ointments or fats to treat the burns, as this may increase the risk of infection. Special burns dressings and gels are not recommended. You may also need to treat the casualty for shock. So remember, when treating burns and scalds, move the casualty away from the heat source, place the burn under cool running water for at least 10 minutes. If it's larger than their hand, a deep burn, they're a child, the burn is on their face, their hands or their feet, call 999 or 112 for emergency help. Treat them for shock if necessary, and that's how you treat a burn or scald. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
We're hanging out at the St. John Ambulance Training Center. Right now I'm joined by Patty, and Patty is the lady who knows everything that's happening here at the training center. Patty, let's first of all talk about what is the St. John Ambulance Training Center?
Well, here at the St. John Ambulance Training Center, we train Canadians to save lives at work, home, and play.
Excellent.
We train kids from 10 to 13 in our Home Alone program, so that teaches them how to be home alone even before or after school for that little bit of time. Yeah, babysitting classes for kids that are 10 to 13, 14 years old, so how to babysit. We have occupational health and safety, standard first aid, CPR, A, B, and C courses.
Yes.
And that's an important one for in the workplace. As well, we have a pet first aid class, so we're quite excited to have that one offered to the public. So how to treat our animals with first aid treatment, CPR, before they head off to the vet, so we can help to save their lives before they get to the vet.
That's excellent. So absolutely everything you can learn here, which is so great to hear. Now, as I mentioned, Ian, who's going to be joining us later in the show again to show us so many important things that need to go into a car during the winter season, is going to show us a CPR demonstration. Okay, Ian, take it away.
First of all, I want to make sure that they're not just sleeping, so we want to do a responsiveness check. So we're going to tap those shoulders and call into both ears. Hey, ma'am, can you hear me? Are you okay? No response. I now know for sure we have an unresponsive casualty. That's always considered a medical emergency, no matter why they're down. So that's my next thing. I want to get a 911 call on the go. Now, I want to remember my ABCs: airway, breathing, circulation. So first of all, I'm going to see, is she breathing? So I'm going to bend over, my cheek over the mouth, looking down the chest. And for a warm room like this, 5 seconds. If you're outside today, we want to do 10 seconds. So 1001, 1002, 1003, 1004, 1005. Now, I found she's not breathing, so my next step, I want to help her breathe. So with that head tilt, I'm going to pinch the nose, pull down the chin a wee bit, and give her 2 good breaths. As soon as I deliver the breath, I want to let go of the nose, sneak a peek at the chest, watch for movement. As long as it's rising, I know air's got in. Second breath. And now ABC, circulation. I want to look for signs of life, which can be at both a pulse check, if you know how to look for a carotid pulse. We found no signs of life. Now I want to start my CPR. And CPR begins with 30 chest compressions. So what I'm going to do is I'm just going to center the heel of my hand on the chest, cover with my lower hand, and straighten out my arms, straighten out my shoulders, and then I want to do 30 chest compressions at 100 beats a minute. 1 and 2 and 3 and 4 and 5, and 1 and 2 and 3 and 4 and 10, and 1 and 2, 4 and 15, 1 and 2 and 3 and 4 and 20, 1 and 2 and 3 and 4 and 5, and 1 and 2 and 3 and 4 and 1.
Wow.
So there's my counter at the end, 2 breaths. And I want to do that 4 more times, so for 5 sets of 30 and 2. The rate is 100 beats a minute, which also happens to be staying alive. Those of us who lived through the disco era know that disco saves lives. So
That's
there you
right.
go. There's some CPR.
That's awesome. And before we wrap up, I just have a question. How hard do you press? I find that's where I would be scared to press too hard on
We
someone.
want to go down about 2 inches or 5 centimeters, so it is a significant amount. You don't have to be afraid of that, because if we're going down just a little bit, we're not doing them any good.
Absolutely. All right. Well, Ian's showing us a little bit about CPR because November is CPR month. Of course, it's useful any time of year, so these are always important things to know. And Ian's actually going to be joining us throughout the rest of the show. He's going to show us important things that we need to have in our vehicle during the winter season. So looking forward to that.
Great.